Hi guys, this is my Perio presentation. So to start out, I have my probe depths. She does have some deeper pockets, especially in her posterior areas, but they aren't extreme. She is also missing a tooth, and we're unsure whether that is due to perio or caries. She wasn't sure either. I don't think that patients really get a lot of talk about those kinds of things when they go in as to why they have to have a tooth pulled or things like that. I think sometimes they're just given the basics and they just go with it. So these are her radiographs. I did notice that there is some bone loss, especially in posterior areas, again, just like the perio chart showed. Tooth number 3 and number 19 also looked like they might be at a risk for furcation involvement in the future. That bone loss just looks like it's creeping towards it. Here are her before photos. I noticed there was erythema, rolling, bleeding, and when we spoke about home care, this patient brushes once a day, and it's when they remember. They also seldom floss, and we staged and graded as a stage 2 grade B. And then again, that missing tooth that the patient was unsure why it needed to be removed. For the profile, there's the staging and grading again, stage 2 grade B. I have them as an ASA type 2, CNC3, and they are age 43 and female. Some medical factors are fibromyalgia, which they take a medication for, anxiety and depression, which is also medicated, and acid reflux. And so I think with all of the systemic conditions, an ASA type 2 was right for them. I chose this patient because of their oral systemic link, because I think that treating the periodontal disease might help with some of those issues, and it's unsure of which caused the other, whether perio caused these systemic issues or if the systemic issues caused the perio, but I just thought that that would be beneficial for this person to treat that and hopefully help keep it from progressing any further. For treatment, we did their eye exam, the full assessment appointment, which I completed as a first year, so it was a while ago, and then the oral DNA was completed as well. We did NSPT in 4 appointments, plus laser, and 4 to 6 week re-eval. We performed the oral DNA, and with the higher risk pathogens, there was TF and TD present. So this patient is at risk for cancers, cardiovascular related concerns, metabolic health risks, and pregnancy risks if she chose to have more children. There were some other moderate risk pathogens and low risk pathogens as well in the similar categories, but those high risk ones were the most concerning. Here are the after photos. There were no real changes in as far as probe depths, but there was a reduction of erythema, a reduction of bleeding. There is still some rolling, which the patient, before their last appointment, stated that they had just had surgery. And so there could be some inflammation from that, and the healing process of that could have been a factor as well. There was a change in home care habits that were mentioned. The patient now brushes twice a day, most days, and tries to floss at least every other day. She did also notice that the bleeding had almost completely stopped and her tissues felt a lot stronger, so there was some progress there, which is great. In conclusion, I learned that patient education and changing the way that people do things takes time and patience. At first, home care was really an issue, and it was really hard to get them to participate in some of the things that I had mentioned for them. So we had to use motivational interviewing to see what would work best for her. And her schedule's really busy, so I even mentioned brushing while you shower or while you watch TV, and um, different methods that might help her there. And she did say that she does like to brush in the shower now. That's something that she really can incorporate into her routine because she doesn't feel that it's taking up extra time. Um, so just using that interviewing to find out where we could maybe squeeze things in. And what I would do differently, knowing what I know now, I think that it would have been more beneficial having that knowledge because I did find my perio patient as a first year. I think that I didn't know a lot of things yet about perio as far as staging and grading and how to treat it or anything like that. So I don't feel like I really fully gave everything that I could give as a first year. And we kind of ended up spacing our appointments out a little bit because of that, because I couldn't do laser yet until we were certified in that, and I couldn't do a lot of different things that way. I also wish that I had taken more radiographs and intraoral photos for reference. I think that that would have helped out a lot more in the long run too, especially there at the end. So yeah, that's all I have.